Miscarriage. In this video, we are going to talk to you about miscarriages, and some people experience recurrent miscarriages. One miscarriage itself is very heart-wrenching and very distressing to the couple and to the pregnant lady who is having an abortion. Whereas when it happens repeatedly, it is a source of great mental agony and trauma to the pregnant lady. And very often they are left wondering what went wrong, and they are asking the doctor and always searching for answers to find out what went wrong and why they are having a repeated miscarriage. There are various reasons for that, but we specialize in recurrent miscarriage treatment, and we have successfully treated several couples who had recurrent miscarriage, and after treatment almost I would say 70 to 80% of the time we are able to give very good results to these couples with recurrent miscarriage. What are the causes? That is what we really need to investigate and look into before we go on to treat these couple, and before they can plan their next pregnancy. It is important for them to undergo a proper evaluation to see what was the reason for the miscarriage. First is, whenever there is a defect in the size and shape of the uterus and the cervix, we can undergo a miscarriage. You need to do an ultrasound and for a few other tests to find out if the shape of the cervix is okay. Many a times ultrasound alone is not enough to diagnose any defects in the shape of the uterus. You need to go ahead and do a 3D ultrasound or other testings like HSG to find out if there is any defect in the shape of the uterus. And also undetected, undiagnosed mother having any diseases like diabetes, kidney disease, heart disease, and all these things, if not taken care of properly, can lead to miscarriage of the pregnancy. Next, coming to the cervical factors, that is, the cervix is the mouth of the uterus. For some women, when the mouth of the uterus is unusually soft and loose, they tend to have a miscarriage mostly after 12 weeks and of pregnancy, and before 20 weeks of pregnancy, suddenly the entire products of the pregnancy is expelled out. Next, immunological reasons like anti-cardiolipin antibody syndrome and anti-phospholipid antibody syndrome are another very often missed reason where one person has a recurrent miscarriage, and it has to be treated appropriately. And many lifestyle factors like improper diet and taking too much of physical activity can also lead to miscarriage. And then genetic factors, it is not only important to investigate the mother who is having the miscarriage, even the husband has to be investigated, because poor sperm quality can lead to recurrent miscarriage. So both of the couples should both the partners should undergo a genetic karyotyping test to find out who is contributing to the recurrent miscarriage. This way appropriately the problem can be dealt with and treated appropriately. Then many hormonal imbalances like thyroid disorders and polycystic ovarian syndrome and elevated prolactin levels, all these also contribute to recurrent miscarriage. If not getting pregnant and suffering due to infertility is one problem, the entire prospect of getting pregnant repeatedly and easily but not being able to hold on to the pregnancy and miscarrying again and again is a cause for great mental trauma to the woman. So we need to have a sensitive approach and at the same time sensibly find out what is going wrong and treat it appropriately to have very good results. And we have had a very good success rate in treating many women who had recurrent miscarriage and have had a very positive outcome.